All right, thank you everybody. I'm Ben Wortham with Catholic Charities USA. I've been with the CC Network for 14 years now. I spent 7 very formative years at Catholic Charities New Orleans, really mentored by a psychiatrist named Dr. Rigram who really taught me a lot of this stuff. And then the last 7 years with Catholic Charities USA, focused on all things behavioral health and healthcare. And so let's do it. And so I've got 25, maybe 27 minutes. I'm going to talk to you about the mental health and the link between the social determinants of health, which I feel very passionate about, and highlight 3 Catholic Charities USA initiatives I've been a part of: the Healthy Housing Initiative, where we combine housing and mental health services, Sister Hope chatbot, and Wholehearted. But first, I just wanted to give you the magnitude of the Catholic Charities Network. I feel like this is the best kept secret, but it shouldn't be a secret at all in the Catholic Church. So we have 169 agencies. We serve, last year alone, we served 15 million people across the country. We have 45,000 employees. I'm one of 70 at the national office. We have 215,000 volunteers who are embedded into Catholic Charities programs, 3,900 service sites across the country. And if anybody, the amount of money, just very simple, $5 billion a year to the most poor and vulnerable in terms of help across the country is what Catholic Charities. We are the largest private social service provider in the country, only second to the federal government. And so we should talk about this. And in the mental health sphere, we have 90 adult counseling programs across the country, 80 youth counseling programs, 65 school-based counseling programs, and many other mental health-based programs as well. I put this photo up here. It was the inception of Catholic Charities USA in 1910. We recreated this photo in 2010 in our offices, and it was at the Catholic University of America is where that took place. So this is what our health is. This is a client's health. This is your health. This is the breakdown of somebody who's having a mental health crisis's health. So 30% are health behaviors, 20% is your clinical care in the hospital and your follow-up to hospitals and your primary care doctor, and then 50% are the social determinants of health, which I think a lot of us here today take for granted. But if you forget, I always say this, if you forget what Catholic Charities is and what we do, we are the social determinants of health. Every single one of our 1,500 different programs and services directly impacts the social determinants of health. And so when you look at this pie chart, you've got $5.3 trillion just in 20% of health. So that's the clinical care, that's our health system. So 1 out of every $5 spent out of Americans' pockets last year just went into that 20%. And so what we're saying is, well, if you come in and you receive a care plan at Catholic Charities, as an example, you could receive housing, income, employment, and a bunch of these services that actually really make somebody healthy. Here's an example I'll give. I don't care how good your psychiatrist or your primary care doctor is, if you leave that office and you go back out to no housing, no education, no family support, I don't think you're going to be a very healthy individual. So I want to make the point that mental health doesn't happen in a vacuum. I feel like recently, especially when we talk about mental health, we get really locked in, like mental health, depression, anxiety, and that's fine. But what I'm saying is, especially with the poor and vulnerable populations, we can't talk about mental health without talking about basic needs being met. We have to talk about access to care. We have to talk about how we can create models to bring some of that $5.3 trillion that's in our healthcare system, and a lot of it's wasted, back up around and into what actually makes somebody healthy on the right side there. This is pretty startling. I'm sure a lot of you have seen this, but this just shows if you're seeing dark red on the map and you are unfortunately born into one of those zip codes there, your average lifespan is 71 years old or less. If you are seeing dark green and you're lucky enough to be born into that zip code, then your average lifespan is over 82 years old. So in America, we're looking at literally a 10-year difference in lifespan based on the zip code that you're born into. And so what we're seeing is not food deserts, we're seeing lack of access to mental health care, just generally a lack of access to services, which again goes hand in hand, those basic services, with mental health. And to take that just a step farther for today, if you're seeing dark blue or dark green, there is a major mental health professional shortage in your area. We actually, for what it's worth, we're doing a little bit better in the Northeast with mental health professionals. But the takeaway here, and I put it there on this slide, is in the dark green areas, 40% of isolated rural residents are over 30 minutes from in-person mental health care. Now, telehealth has done wonders for us, but especially that initial appointment, or if somebody's having a psychotic break, the fact that everyone you see in those green areas and blue areas, which is pretty much the whole US, is for the most part over 30 minutes away from a mental health professional. It's something that we have to work on as a society as we move forward. So I'm going to talk to you a little bit about the Healthy Housing Initiative. I feel super passionate about this one. I worked on it for 5 years with my colleagues at CC USA. We created almost 800 units of permanent supportive housing in 5 cities and Catholic charities across the country, and we embedded mental health services into each one of the housing projects and into the apartments for the chronically homeless. I could literally give an hour or longer on each one of these agencies and the work that they were able to do in Detroit, St. Louis, Las Vegas, Portland, Oregon, and Spokane, Washington. But for today, I'm just going to point out Catholic Charities Eastern Washington, that building right there where the arrow is pointing, to highlight this one. So this was a collaboration. It's called Gonzaga Haven, and it's 72 homeless families that moved in there. And this is a collaboration between Catholic Charities, Catholic Health, and Catholic Education, Gonzaga University. I went to Gonzaga University, and I'm a little biased here, but so this building, these buildings are actually nicer than, as they should be, than the dorms I stayed in on the campus. And so this is literally a pipeline. So again, these are ideas for you and what we're doing. If you come in as a homeless child into this building early on, you then have free access to Gonzaga Prep High School and then to Gonzaga University. So it's literally a pipeline if you make it in as a homeless family and a child there to make it out. And so their CEO, Rob McCann, who's been instrumental in this, sent me a one-sheeter that showed all of the different colleges and programs at Gonzaga University and what each one was doing. It was amazing. And I just pulled out a couple to show you the practicality of it. So the nursing students were coming and giving their time to support physicals for kids so they could go to camp. They were providing, the law students were providing free legal clinics, and the School of Business was providing budgeting classes. And there was a whole list of all the other ones. And so just think of that, Catholic Health, Catholic Charities, Catholic Education, all massive coming together to serve homeless individuals in that one building alone, if you were lucky enough to be a part of it. And so on top of that, we had Catholic Charities case managers and mental health professionals from Catholic Charities also embedded into that building. I wanted to make the point because when we talk about, so let's say somebody's homeless living on the streets, and then we at Catholic Charities do the street outreach, and we house them, and we provide housing and social services and mental health care for the rest of their life. There is a significant cost savings attached to that. So we're showing, so we had Delaware State University, who were our evaluators for the initiative. They came out with this data. This is based on 193 of those homeless individuals that we had pre and post data on. This came from the health system itself and also self-reported. And so what we found was, we calculated in the 6 months that 193 individuals were homeless living on the street, we got how many times they used the emergency room and hospitalized. And then we got the data again and ran the data again with the hospital systems on after they were housed and received services for 6 months. And what we found was, just in those 6 months, pre and post, that there was a 66% drop in emergency room visits and 66% drop in hospitalizations. This is a massive cost savings. And if you extrapolate that out, a lot of these individuals, they weren't just using the ER inappropriately for the 6 months before they were housed, potentially using it for 20 years in this type of way. So you can imagine extrapolating that out, this data out, to how much is actually being saved when we provide housing and social services. So this is about to be released to all Catholic Charities over the next month. On page 38, and I'm highlighting it now, from our evaluators, the drop in emergency room visits and hospital stays would result in an estimated savings of 4.91 million per 402 new clients in the first 6 months of housing. So it's about a $12,000 savings when somebody goes from living on the street and into housing and receives mental health. And so where we're going with this is there is, and you saw that $5.3 trillion that our healthcare system is, these are examples of models where we're trying to show the money's there to support mental health. We're developing models right now, and we have to be able to figure out how to take some of that wasted 5.3, our broken healthcare system dollars, and put it right back up into mental health services to address what's going on. So we should be really hopeful that we have a health system that is that large because the resources exist. And this is a map that shows all the yellow dots are Catholic Charities agencies, and all the red dots are Catholic hospitals. So these are just two footprints, but imagine there's really good work right now in a lot of these red dots. So we always say, look where you see a red dot and a yellow dot, and wherever you see a close yellow dot and a red dot, that should be a Catholic Charities and a Catholic hospital working closely together. There's a lot of great examples of these, but just to, if you're with a health system out there, the potential for Catholic Charities nationally to do something with these national health systems is there. And that's really what I've been focused on and what our team's really after right now to create these models. And I'd be remiss if I didn't show this. Our amazing newish CEO, Carrie Robinson of Catholic Charities USA, we just came out with a new strategic plan. And I am the new regional coordinator for Region 6, which includes New Jersey. So I'm with my people here today from New Jersey. And so I think looking at that other map, it can get overwhelming when you think of the whole US. And what we want to do is we want to simplify. We want to say, New Jersey, let's talk about partnering with Pennsylvania. Let's talk about partnering with states right around you. And so my new role is to literally learn about the Catholic Charities agencies in Region 6 and then connect them to one another to try to create these sustainable models and really be the glue between them. And I have a lot more to say on that if you want to follow up with me after that with those models and to get that information out there. This one is super cool. It's the Sister Hope chatbot. We've been working on it since 2021. It's a lot of ebbs and flows on this one. It combines AI capabilities, mental health, and the social determinants of health, and I will explain. So quite literally how it started in 2021 is, and it's still like this, you have an SMS phone number. And so when clients come through the door, they are given a phone number and they can chat with Sister Hope. And you can only chat with Sister Hope about mental health and wellness. And so after we started to see that thousands of people were chatting with Sister Hope, we said, all right, let's see if we can actually refer people who are chatting about mental health back to actual Catholic Charities services. And I'm going to give you a couple amazing examples. Right now in northern Kansas, we have AI capability where when, let's say, a client receives the QR code in the church bulletin, or they receive it from the Catholic Charities, it actually asks them, are you food insecure? Okay, so it finds out they're depressed and anxious, right? And then it says, well, are you depressed and anxious because you're food insecure? And some people say no, but if you say yes, then it says, what's your zip code? And you put in your zip code and it says, we have a mobile food truck at Catholic Charities Northern Kansas who's going to be at this address on this day. So you can come anonymously to come see us, and we have food for you if you need that. So, and that's just with Northern Kansas, and I think that's a really good one. And then who doesn't love a good affirmation or quote? I know I do. And so in their Sister Hope bot, they're actually building in little prayers that they're sending to people who are using it for mental health and wellness. Amazing example of how we're using AI and driving people who are depressed and lonely and chatting with us about mental health back to Catholic Charities services for what the real root cause of maybe why they're experiencing that mental health crisis potentially. So we have 25,000 people right now across the country, across 18 agencies who are chatting with this bot currently. Another really interesting example at Catholic Charities Wilmington, we're driving people to a diabetes prevention program with Trinity Healthcare. To increase referrals there. Oklahoma City, we have had 800 people be referred to in-person counseling after chatting with the bot. Now, only a fraction of those have actually come through the door that we know of, but Catholic Charities Oklahoma City actually has reports, live people who've come through the door who said, I got the number and address for this counseling, in-person counseling program through getting the number in your church bulletin, and that's why I'm here today. Another really interesting one that Oklahoma City is doing is they have it says, are you depressed and anxious? And if when the bot finds out that you are, it says, have you considered volunteering at our Catholic Charities? This is how you can volunteer, and it gives the volunteer link and drives people who are depressed and anxious to volunteering at the local Catholic Charities. Again, out of maybe in social isolation and driving with AI capabilities to in-person services. This is a really amazing one too. Catholic Charities San Diego is just about to go live with this. We're actually asking, so there's 90 parishes in San Diego, and it asks them, would you like to be connected with your local parish? And so when they say yes, it gives them the number and information to connect with their local parish. And the whole idea behind it is after about a year or 2 years of us being live with this, we have a very simple dashboard where the CEO, Vino, is going to be able to log in and say, and then present it back to the priests of the diocese of the parishes and say, hey, we just want to let you know we've driven all these people to you using this mental health chatbot for more support from your parish. Again, driving people from social isolation using the bot, chatting, to in-person services using AI capability. Catholic Charities Los Angeles, we're building in immigration support and know your rights into their bot. And then we're building this disaster preparedness. So unfortunately, if and when the next forest fire in LA happens, CCLA has this number that they can give to everybody. All their outreach workers have this number right away to give to people to say, hey, we've got this disaster preparedness bot that we just turned on and you should check it out and use it. Now, we thought we have had ebbs and flows of this. You guys got the really good version. There was obviously some growing pains with all of this, but it's been really, really amazing to see some of what Pope Leo has been saying about this, and we really feel like we're on the right track with what we're doing. And so one of the things he said fairly recently, we must also treat one another humanely, nurturing emotional, spiritual, social, and ecological intelligence. Therefore, I say to you, learn to humanize the digital, building it as a space of fraternity and creativity, not a cage where you lock yourselves in, not an addiction or an escape. So it's that as we're dealing with this loneliness epidemic, we want to drive people who are chatting with these AI bots to services and to the real, the food and what could be causing that mental health, and more specifically to social engagement. So using AI to drive to social engagement, not to say this is the end all be all, chat with this bot and you'll be great, to say chat with this bot and we are going to help you with your basic needs and drive you to in-person care. And lastly, at Catholic Charities USA, this has also been great. Over the last bunch of years, we've worked on what's a trauma-informed workshop and resources for parishes called Wholehearted. If you go to our website, catholiccharities.usa.org, you can just type Wholehearted in and you can find all the materials for it. It was developed by our CCUSA consultant, Dr. Mike Carrata. Wholehearted is a parish-based resource focused on the impact life's painful experiences have on mental health. It integrates spirituality, religious practices, and behavioral health. It's meant to provide basic and helpful mental health awareness, and it focuses on recognition, renewal, restoration. I took a screenshot of the participant journal. On this slide, you can see the facilitator guide. You can do it yourself, but we also have Dr. Mike Carrata, who could come to your parish here, offering this service now if you want to check in with us afterwards. Dr. Mike Carrata said to stress when I was talking to you all today, the best way to describe Wholehearted is to think workbook. So everything is, so you could do it yourself again without him coming, but he's been to Archdiocese of Phoenix, Orange, Madison, Youngstown, Green Bay, and he's coming to San Diego soon, and he could be coming to your parish too to jumpstart you. It's about a 5 to 6 hour day, and he'll lead the parish, usually in collaboration with the Catholic Charities leadership through this training. And it's a great resource for the Bishop's Mental Health Sunday, which is this October 10 and 11. This is actually on USCCB's website, so I just wanted to say thanks to USCCB. It meant a lot to us that this is featured on the USCCB website as well. So that's a whole lot of very quick talk and hopefully some ideas there for you. I just wanted to loop back and just for solidarity with other countries around the world. I'm on this group called the Caritas Health Task Team Committee, essentially working with leaders in health in other countries across the world. We came together in Rome recently, and the takeaway that I had, the number one takeaway from the week of being with these experts in these countries was they are working on mental health too. It is all over the world right now. This is being focused on in third world countries, first world countries, all over the place. And so we're not alone in this. But I also wanted to put the spin on it that I was lucky enough to go to Ukraine with Archbishop Gudziak some years back after the war had started. And this was the situation when I got there, is two out of three children had been displaced from their homes in Ukraine. And their broken healthcare system didn't have enough physicians even to deal with the amputees that were coming back. So I wanted to say that to be in solidarity, but also, again, go back to this $5.3 trillion that we have in our healthcare system. We have the monetary resources to figure out the mental health crisis. It's there. You know, we just have to allocate resources a little bit differently. But unlike other countries, we actually can solve this tomorrow if we have the right policies put into place. So we should be in solidarity with the rest of the world, but also extremely hopeful and thankful that we live in the United States of America and we can talk about this the way we do. So the last 4 things I'm gonna say here. How can we help now? Stop thinking about mental health as just a silo. Like, we can't just be like mental health and it's just, we have to think about it as integrated care. People need basic services now. And so the Catholic Church is positioned perfectly to be the leaders, and they're doing an incredible job at this right now of being that food when somebody shows up, because that's going to impact mental health maybe more than the counseling would. And so to give ourselves a pat on the back for that, but just to remember, we want to think about integrated care, holistic care, and not just get honed in on just mental health. There are 10 states that still don't have Medicaid expansion, and this is a travesty. You have it here in New Jersey. I'm looking at you, Texas and Florida. We have millions of people who don't have Medicaid, which means they can't access basic mental health services at community clinics in their states and in their areas. And so we really need Medicaid to be expanded in every state across the country. And this one we should all feel really strongly about. We need to raise Medicaid reimbursement rates to match competitive salaries for mental health professionals. It is so difficult for Catholic Charities to hold on to licensed social workers and licensed professional counselors because we can't afford them, because the Medicaid rates only pay a fraction of what it actually costs to keep them. So we're on a 10-year trajectory right now where we're not gonna have mental health professionals helping the poor and vulnerable anymore, because nobody's gonna, right now if you do the math, which we have, if you only took Medicaid clients, you would make half the amount, you would make somewhere around a $40,000 to $50,000 salary. If you took only private pay or private insurance, you make over $100,000. This is where we're heading right now, and Medicaid reimbursement rates are getting cut. It should be going the other way. And just a reminder, if this doesn't get fixed, we are in 10 years not going to have people to serve the poor and vulnerable, which we really need to just pay attention to and advocate policy strongly. And lastly, let's all keep collaborating together. We're not going to solve this alone. We have big Catholic organizations, even just those collaborating with one another. You saw a little bit of the impact today. So I'm just really proud to be in a room like this of people who care, and you should care. And just want to say thank you to Jim King and Jennifer, who was dealing with all the slides and all of that. And thank you to USCCB and everyone for working to improve mental health in America. This is a great group today, and thanks for listening to that.